Welcome, friends and followers. This is Nurses Talking. I am Dale Barzi. As always, if you like what you see and hear, subscribe, give us a like, leave us a comment. Today, we're talking to Dr. Latonya Thomas. Dr. Thomas is an experienced registered nurse, licensed in the states of Louisiana and Texas. She received her Bachelor of Science degree in nursing from McNeese State University in 2010. Continuing her education in nursing, she obtained a Doctor of Nursing Practice degree from Capella University in 2020. During educational studies at McNeese State University, Dr. Thomas worked as a certified optician. While in graduate school, Dr. Thomas worked full-time as a registered nurse in multiple specialties, including medical surgical, telemetry, pediatrics, labor and delivery, postpartum, transitional intensive care units, urgent care, and school nursing. And she also worked as a travel nurse. Dr. Thomas created, executed, and evaluated the effects of education and self-efficacy rates on how to increase intent to exclusive breastfeeding in the state of Louisiana for her doctoral capstone project. Dr. Thomas partnered with a local natural birthing facility to implement and evaluate these educational strategies to address the overall low exclusive breastfeeding rates. Her goal of this project was to bring awareness to lack of appropriate knowledge for pregnant women and how early education could improve confidence levels, which in turn would increase inclusive breastfeeding rates and improve health outcomes overall due to the positive benefits of breastfeeding. Dr. Thomas did have her doctoral capstone manuscript published in the National Sigma Theta Tau Repository and progressed. Dr. Thomas also presented this manuscript at the 46th Annual Transcultural Nursing Virtual Conference in October 2020. Shortly after completing her doctorate in nursing practice, Dr. Thomas studied to become a certified legal nurse consultant and a certified meditation instructor. She has opened 2 of her own businesses for these areas. Dr. Thomas continues to work as a registered nurse and is constantly looking for new ways to improve patient outcomes and make a difference. Dr. Thomas, welcome.
Thank you for having me.
Thank you for coming. I have been so looking forward to speaking with you. Thank you so much for your time. I appreciate it.
You're welcome.
So I have to start with a question I ask all nurses, and that is why? Why are you a nurse? Who inspired you? What inspired you?
I wouldn't say someone inspired me, but losing my dad at such a young age, and being in that realm of the healthcare setting actually brought about a spark in me to bring about change because of some of the things that I noticed that took place during his care and his stay. So that alone lit a spark under me to start and actually embark on this journey of being a nurse.
Mm-hmm, mm-hmm. Okay, so you had no other.
No.
So were there obstacles to you becoming a nurse though?
Yes. Financially, losing my father, so I didn't have my 2 parents to actually back me. My mom was a single mom.
Mm-hmm.
So finances was a huge ordeal. And originally when I started, I had that freshman year where I wasted time and money and literally I went to ULM first in Monroe, and that whole entire year was wasted pretty much. So I think I wound up going back home saying I was going to get a job and live with my mom and, put forth the effort and really do what I needed to do. And that led to me, that initial journey was, they got transferred in like 25 hours from ULM and McNeese accepted like 17.
Okay.
So literally, well, no, it was 25, and then I actually had to retake classes. So I retook about a good 17 or 20 hours of those classes that I actually transferred in to even be considered to be in their program. And that was one obstacle. The second obstacle was once I got there, I remember being told, you're not going to get accepted into our program because you didn't complete majority of your classes here at McNeese. So I had to really sit back and self-reflect and say, okay, what am I going to be doing? Is this what I really want to do? How am I going to move forward? So then that took me into a different mind frame of where I focused and I sat down. I took the entrance exam, got in first try, stayed in. And then it was one other obstacle once I got into clinicals.
Yeah.
We get into all of that, the prereqs, and once you get into clinicals, it's a different ball
It's
game.
a
Right?
different.
So I was okay, just doing the footwork and doing this and doing that. But that adult medical surgical class was that first initial class where you had to apply everything.
Yeah.
And I just remember that entire semester, I was flunking. I had maybe a D. And I kept saying, what am I doing? Like, I can't get it. I can't get it. And here I'm working, full time, still trying to balance everything and maneuver through. And literally my two instructors was like, well, we think you're working too much. I was like, well, I don't have a choice because I have bills to pay. My mom can't put my bills in her bills. So
Yeah.
eventually, it took okay, I'm not working this much. I'm going to change my schedule. This is what we're going to do. I'm going to put this much effort into studying and have a study buddy. And literally, she helped me kind of grasp everything, but it boiled down to the final. Like me, I needed to make this grade to pass with a C. And I don't know how I did it because it was a comprehensive final.
Yeah.
And I made exactly what I needed to make to pass. And after that, it was smooth sailing throughout the rest of the program.
And that is always an issue. I want to know from nurses because I find that, first of all, it's not quite what we think it's going to be, and it kind of takes you back a little bit, and so you really have to put forth that, gather yourself, as you say, and step into it. So that's and I see, so you've sailed through so many different areas of nursing and done so much. If you had to pick a specialty other than what you have right now, what would it be?
Pediatrics.
Yeah.
Yeah.
Why? You just love the kiddies?
I love. That has always been, it was either, it's either pediatrics. Pediatrics is my first love. And then once I got into labor and delivery, I kind of got the best of both worlds because I always wanted to, keep my skill sets up.
Yeah.
Work with adults and still work with the kids. So at one point in my career, I was doing both. And then once I got into labor and delivery, it's like, hey, I get to do both. I get to take care of the women and I get to take care of the newborn babies. Like, I enjoy this. Like, this is it.
Yeah. Being there, when someone actually enters this planet is a thrill that, cannot be compared to any other thing. I have to tell you, I'm a person I'm an adrenaline junkie. I like things that thrill me. I don't think I've done a lot of things that thrill me. I don't think I've done anything that thrills me quite as much as that. So I get it. I get what you're saying about that. So then you've gone through all of this. You've become you did your doctoral thesis and all of that, and you're a legal nurse consultant. What drew you to that?
That was the research.
Mm.
I'm a writer.
Uh-huh.
And I didn't realize it until, I started embarking on that journey. And 4 years of writing papers and putting things together, you learn. I picked up on my niche, and that's what it was. And I love being in the background of everything and being able to put things together and really make a difference and actually, put it on paper, give them to them. Okay, we're going to implement this process. And then I get to evaluate it to see how it's going to fall into place. And I kind of get that same joy from being a legal nurse consultant. I have an attorney that I've worked with. So it's been, and I've learned from him too, teaching me, hey, yeah, I need you to educate me on this, and this. You're the expert in this field. So you give me your knowledge and then I compile it and just put it, go through the medical
Yeah.
and put it all in one document. So when he goes to do his cases in court, he can just say, you know, what he needs to say, and it's still it basically it's a whole different ball game, but it's another, I don't know, it's another joy for me.
So you're his light bulb, so to speak. Eh?
Yes.
Exactly. Exactly. So do you find that there are many opportunities for legal nurse consultants?
Yes, there is. I think a lot of what because I'm still building my business around it. It's a lot of, there's a lot of people that don't really know what legal nurse consultants
I
do.
know.
There's
That's why I asked you.
a lot of attorneys that are like, you know, when I do present myself, they're like, well, what can you do for me? What could you bring to the table for me? So
Mhm.
for me to be able to sit down and explain that to them, it's kind of like, they're like, oh, well, I don't know, you know, let me think about that. So, but some of them, because, you know, some of them are really on board with it and
Mhm.
putting together your whole production package and just being able to present yourself in a manner to have them understand what you can bring to the table. And then even with that, like, not just being a legal nurse consultant, we can be nurse expert witnesses.
Yes.
You could be behind the scenes or you could be in the forefront. It depends on, you know, you have so many different outlets and so many different things that you can do. And I'm still learning. And I had a nurse tell me the other day, she was like, well, you can start doing DME exams. And I'm like, well, what is that? And
Mhm.
she's like, you basically will go, like, say the opposing attorney has they want that client to have an exam. Well, you can go to that exam and you know, you watch that
Watch
provider
them.
do
Mhm.
that exam, and if you notice that they do something wrong or something out of, you know, that wasn't supposed to be done, then you could document that and you put that, and they can use that on the opposing side. So it's just like, it's very cool to see how many different realms you can get as a nurse
Mhm.
and as a legal nurse consultant.
Mhm. 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 Awesome, awesome. And you know, I ask you because that's one of the reasons for this talking to nurses thing. I want us to know, and I want the general public to know, and I want us as nurses to know just how many opportunities there are out there. Even in each specialty, nursing still has so many opportunities within it. And so I'm, you know, that's one of the reasons I want to talk to nurses and all kinds of ways. And so now you're into meditation.
Yes.
That links into one of the things I always want to ask nurses, and it has to do with self-care, because we tend to, like, you know, go like rabbits on a wheel and neglect self-care. So tell me about this meditation thing. Why did you start that?
So I started meditation back in 2018.
Mm,
um it became an outlet for me. I went through postpartum after having my son, so I went through a lot mentally.
right.
And just looking back on my career as a nurse, a lot of times I just was that nurse. I was just going, and I never took care of me.
Yes.
And I think once I had my son, that kind of hit home, all of that just kind of piled on top of everything. So eventually, once I got to a better state, I said, oh, well, I need to find something, you know, that's going to help me stay grounded, be able to find peace with myself and be happy and be in my own space.
Yeah.
So I started researching and looking up things, and then I said, okay, I'm gonna start. Um, Started by myself, you know, just gaining knowledge, putting things together, sitting for 5 minutes at a time, and then gradually working myself up to sitting at about an hour and a half each session. But I noticed the difference in, you know, the way I carried myself, the way I act, the way I responded to certain things, just as a whole. So it was just kind of like, okay, yeah, I think I'm gonna start incorporating this. So just to know where I've come from in my journey, that's what helped me. I was like, okay, well, maybe let me look to see if I could become certified in this and actually, you know, teach this to people, because that's something that I think a lot of people can gain
Mm-hmm. Mm-hmm.
that love, that sense of self, that sense of healing from. So that's been my goal with that, pretty much.
It's good that you had that insight, though, to see it. And you just said something that really resonated with me. It's that you talked about how it affected how you responded, you know, to other things. And that's a huge thing for me, because very often, we just respond off the cuff. And so
Yeah.
that's a huge thing for me. So I'm so glad to hear you say that. COVID. I cannot talk to nurses anymore without talking about COVID. How has, first of all, you're in Louisiana, you're in Texas, right? And what we hear about Texas, in many instances, is, it's a little resistive. How does it affect your practice?
And I've still been kind of on the fence myself about it. But it's been so dramatic and so instrumental in just the education piece of things. I think a lot of people, and just even looking in the news now, a lot of people think, I said, well, why did who decided to drop the mask mandate? Who, just because we're getting vaccines doesn't mean it's going to, it's not going to help the situation. So then I'm like, that goes back to education. Like,
yeah, exactly.
Who did this?
Exactly.
But even me, me being, I went this whole entire pandemic, working and being laid off and doing these things and not actually being infected. So for me to get COVID last month, it really hit home. I'm like, okay, well, maybe I should have took the shots. Maybe I should have sat down and, just thinking about everything. But then I'm still sitting back, I'm like, we still defeated the purpose. You enforce these things for us to help the community and reduce things, but we are right back where we started.
Yeah, and that is like you mentioned education in that, and that, I think, if I have a beef, that's it, because there's a lot of education, a lot of information being thrown at people, but when you sift it out, not a lot of it is really educational. And so you cannot help but wonder, well, why are people so, people feel like this, so perhaps we need to do a better job of really just basic education regarding that. As I speak to people, I realize a lot of people seem to think that, the COVID pandemic is going to be, gone in a couple of months. All we have to do is, it's not going anywhere.
It's not going to be here to stay. It's us getting it under control.
Exactly. It's a matter of control. It's not a matter of banishment, because it's not going. It's going to keep mutating and varying and doing whatever, but it's a matter of control. That's my view. So given that, how do you think that we're going to practice going forward? How is it going to affect our practice, you think?
We're changed. We're changed for the longevity. I think it's going to be, I've run into a few nurses that are still kind of terrified, scared. Yeah. It's like, okay, well, what are we doing? And PPE is something that's always been in the nursing profession, but it's now is really so on the forefront, and it's going to be there until we get it under control. And then it's still going to be an important factor to even move forward, to continue to keep it at a lower rate.
Yeah.
So it's changed. It's changed us for the long haul.
Yeah. I think first we need to accept that, as healthcare providers and as consumers, we need first to accept that before we can even wrap our heads around going forward. We need to accept that. So what do you see when you look at nursing? Because you're a younger person. Me, I'm getting up there. But when you look at nursing and nurses, what is your vision? What would you like to see?
I would like to see change, more compassion, more education. I think I'm a firm believer that education is as a nurse, you are an educator. Yes. And you can change so many lives just by educating. And I've run across so many nurses that are not, either for education or even talking to their patients or even interacting and being compassionate and just being there, being a listening ear to understand, okay, where we are, let's evaluate where we are, acknowledge it, move forward, and develop a plan if we want to bring about change. It's all the same process. Like we are constantly being able to bring about change. So you have to be one of the ones that's going to stand in the forefront to help develop change and bring change and let us continue to grow in our profession and actually be positive outlets, be these educators, and be able to make a difference in the world as a whole.
Yeah, yeah. I'm glad you said a lot of people go into nursing, I think, not realizing that it involves educating. And I don't know if the education of the nurse itself actually stresses enough about the fact that you are an educator. Yeah, you came into the profession to take care of people, but taking care of people includes one of the steps, one of the big legs of that thing is educating. As a nurse, I think one of the things I would like to see, I want to see more nurses at the political table, or at least not even the political table, but at the policy table, probably is what I should have said, at the policy table. So many times so many policies are made and stuff like that, that nurses don't have any input. And if we had input, this is my belief, that if we had input, the policy wouldn't look the way it looks. It would be a lot more user-friendly, for want of a better term.
Yes. I've been on that side of it as well since I completed my doctorate. There's been a couple companies I kind of helped get up and running, so I was able to create, policies and procedures and get things in line and help them get, their documents and everything in order to register with the state. So that's why I said, just to be on that other side of it and not be at the bedside, it opens your eyes to a whole lot more.
Yeah. So I know that, we briefly talked about meditation and stuff like that, but to me that, that also includes mental health. Do you think that we are becoming a little more aware of the importance of mental health? I mean, in recent weeks, couple of months, a couple of high-profile athletes have focused on their mental health. And now I hear that we're kind of like talking about it, and all the news sound bites and stuff like that are talking about it. Is this, you think, going to, are we going to absorb this and be aware that how important mental health is? Or do you think it's just going to be another sound bite that comes like in the same way that, for example, when you have a mass shooting at a school and they say, oh, he had mental problems, and then that's the last you hear of it, Do you think we're going to be a little more open to this now?
I think so. I think with COVID hitting, it's been so many, the statistics for depression and anxiety has increased so much. So I think we are embarking on this journey to actually bring more awareness to mental health. I thank the athletes that actually have come forward and step forward. Hey, you know what? I need to take this day to me.
Yeah.
Because it takes you acknowledging that you're going through something, and it takes that you have to be the one to speak up for yourself and take that step back. Because if you don't, no one else is going to do it for you.
Exactly.
So I think it really is, we're on that journey. I think it's just going to take time. And even with me doing some research, I've been noticing with meditation, like I just did a talk recently. Children are meditating even more now in schools. They are offering it in schools, they're offering it in hospitals, they are offering it in the workplace. So I really think we are on the right path to bringing about this change and bringing about more awareness to mental health and how it can, it affects our whole being as a whole.
Yeah. And to recognize the signs, recognize the symptoms, recognize that you're not just tired. I would like to see, for example, in the workplace and industry and whatever, that part of your, I should be able to call up and say, I just need a mental health day, without feeling that I have to offer many explanations or give to the about it, or, actually, you should be able to say, I really need a mental health day, But anyway, maybe we will get there.
I think we will. I think it's just going to take some time.
Yeah. What would you say is your proudest achievement? What are you most proud of?
I would say completing my doctorate and being able to make a huge difference in the state of Louisiana. That was monumental for me, because I when I embarked on the journey, I didn't think that was going to be my outcome. I really went into it blindsided. I know I kept saying, I think maybe a year or two before I got close to getting into the doctoral capstone portion, I was like, oh Lord, what am I going to do? Like, what's going to be my topic? And then I started thinking, well, how can I make a difference? Let me find a topic where I can actually make a difference with something in the state of Louisiana. I didn't even think about the world. I just said in the state of Louisiana. that was a huge accomplishment for me. And being able to present, I would have never thought that I was going to present at a conference, at a big conference, huge conference. My mentor was the one that she was like, no, you need to present this. You are covering this. And I'm like, no, I don't want to. And she's like, Latonya, I'm telling you, you need to present this. So just to go through, and I think it was just not knowing, like me being in that stage of not knowing what I needed to do, what was going to happen, how was it going to occur. So a lot of it, I was just like, I don't know, if I'm not used to doing that. No, I don't think I'm gonna go that route. But just to push myself through and say, okay, yes, this is what I'm gonna do. Okay, what do I need to document? How do I need to move? And to do it, it was amazing. It really was.
Awesome. So jumping off from that a little bit and to go back to your resume, part of what you did do was, looking at education, how it affects exclusive breastfeeding and stuff like that. Were people very receptive?
People were. And my biggest goal with that was I know from my pregnancy, when I went through it, I didn't get my OBGYN saying, okay, are you breastfeeding? Are you thinking about bottle feeding? What are you doing? Early on in the first trimester, second trimester. So I felt like, I was like, that lack of education, me leading up to it and just taking care of patients on the labor and delivery side. It's like, those patients come in the hospital and they're like, when you like, oh, you're going to breastfeed or bottle feed? And they're like, bottle feed. Like, well, do you know, like, did you think about breastfeeding?
Think about,
yeah. Can I educate you? Do you understand the benefits of it? Like, do you understand the pros and cons of what breastfeeding can do? And a lot of times they were just like, nope, bottle feeding. So I really took that as like, okay, well, I could utilize this to actually help educate people. So it wasn't as many people as I would have liked to come, because of the whole pandemic had hit. So my project took a huge toll, but I wound up having to tweak some things, and I got to teach some classes online, and I got a lot more participants from that. So a lot of them really were like, yeah, we need to, I think this is going to work. So even I think that natural birth facility, I actually sent them everything. So they have all of my educational tools that I utilize, so they can actually incorporate and start their breastfeeding classes and whatnot back up. So it was, I think it is, most of them are receptive. I think it's just that lack of knowledge, not knowing.
Because, I became a midwife in the 70s, right? in the United Kingdom. And that was one of the things that really we encountered as well. As you said, you know, the question was, you breastfeed a breast or bottle? You know, there was like, I don't even know why we're giving them the choice.
Because usually you know what the answer is going to be. I'm like, okay,
Yeah,
I had to ask. I'm sorry.
yeah, you know, you came with your own food. What's this? I know, so I get that. It was consternation a little bit. So Latonya, before we go, is there anything else that you would like to talk to me a little bit about?
No, I think we touched on everything.
Well, thank you so much. I really, really, really do appreciate it that you took time to speak with me this morning.
You're welcome.
And I look forward to it, and I'm so happy that you did.
Yes, ma'am. I appreciate it. I appreciate the opportunity.
Thank you.